is, and I'm a senior on the Georgetown women's lightweight rowing team. Today we're going to talk a little bit about HIV. So HIV stands for human immunodeficiency virus, and it basically does what the name sounds like. So HIV infects the cells of your immune system, and it stops your body from being able to fight back against other germs and diseases. So HIV is transmitted through 5 fluids. It's transmitted through blood, semen, precum, vaginal fluids, and breast milk. A common misconception is that HIV can be transmitted through saliva, and that's not true. And so you can't transmit HIV by kissing someone. A lot of people ask, because a test for HIV is actually like a saliva sample, and so people ask if you can tell if you have HIV by testing your saliva. How can you say that HIV can't be transmitted through saliva? And the answer to that is that the test is actually for antibodies to the virus, which can be in your saliva, even though the virus itself is not. So, how do most people in DC contract HIV? Well, HIV can be transmitted in a number of ways, basically through contact between any of these fluids, including sharing needles and transmission from mother to child. Most people in DC specifically contract HIV through unprotected sex. So that brings us to our next question: how can I protect myself? So we talk about, when we talk about HIV for prevention, we talk about the ABCs. The A in ABC is for abstinence. And abstinence means not having sex. And so because HIV is mainly transmitted, in DC at least, through unprotected sex, if you don't have sex at all, you don't have a risk of contracting HIV in that way. The B in ABC stands for be mutually faithful. Being mutually faithful means that you're only having sex with one uninfected partner. So it's important, if you're going to choose that method to protect yourself against getting HIV, that you and your partner both know that you're not infected with HIV before you begin the mutually faithful relationship. The C in ABC stands for Condomize. While there are a number of birth control methods out there, condoms, both male and female, are the only birth control method that protects against HIV because they are the only birth control method that prevents the exchange of fluids. And so because condoms are a physical barrier, they prevent the different fluids that can transmit HIV from coming into contact with one another, and so they prevent the virus from being transmitted. With condom use, there's sort of a caveat to that, and we talk about the 3 C's of condom use. And so the 3 C's are condoms, consistently, and correctly. So it's important that condoms are used consistently and correctly to protect you against contracting HIV. So there are 2 other ways, or 2 other methods of protecting yourself against HIV. One of those is PrEP. So PrEP stands for pre-exposure prophylaxis. It's basically the same medication that you would take if you did have HIV, and you take it before you get infected. So PrEP is prescribed to people who are at an increased risk for contracting HIV, and people who take PrEP you have to take it consistently every day, but people who take PrEP consistently every day have a 99% reduced risk of contracting HIV. Something else that's important about PrEP is that, similar to birth control, you have to take it for a while before it starts being effective. And so PrEP you have to take for 7 days before it reduces your risk significantly of contracting HIV. The other thing that we talk about when we talk about HIV prevention is PEP. So that stands for something close to PrEP, but no R. And PEP stands for post-exposure prophylaxis. And so you would take PEP, like the name suggests, after you think you've been exposed to HIV. So it's a higher dose of the same medication as PrEP, and you take it for a month after you think you've been exposed. So how do I tell if I have HIV? the only way to know if you have HIV is by getting tested. So something we talk a lot about to our kids is that there's no way to tell if someone has HIV just by looking at them. So people can have HIV for a while before they would show any kind of symptoms, and even if they are showing symptoms, you might not be able to see it. So you might not even know if you have HIV, so the only way to know is to get tested. In DC, you can get tested at hospitals, clinics, and on some days at the DMV. So what do I do if I do have HIV, if I get tested and I'm positive? So there's actually a treatment for HIV, and it's called ARVs. So ARVs are antiretrovirals. ARVs are a medication that you can take if you are HIV positive. So while ARVs can treat HIV, they're not a cure for HIV. So once you're HIV positive, you can get your viral levels in your blood under control and live a long and healthy life, but you will still be HIV positive. So ARVs, again, are a treatment for HIV, but not a cure. Beside the sort of main reason to take ARVs, which is that they can help you live a long and healthy life, another really important reason to take ARVs is that if you can get your viral load low enough with ARVs to the point where it's undetectable, you can't transmit HIV. So we talk about something called U equals U, and it stands for undetectable equals untransmittable. So as long as you're taking ARVs consistently, again, you have to take it every day, you can get your viral load to the point where it's so low that you can't spread HIV to other people. So, recap, HIV is a virus. It has no cure, but it does have a treatment that you can take to live a long and healthy life and not spread the virus to anyone else. The only way that you know if you have HIV is to get tested, because you can't tell if someone has HIV just by looking at them. Yeah, anyway, signing off. That's all we got for today. Yeah.